Okay, reflexology. So this is kind of a general overview. It's not going to go into a lot of depth, and you should not consider yourself trained in reflexology, but exposed to it instead. Let's go ahead and jump in. I want to talk about first the theory. The intention in reflexology is to increase life force through its respective zone by applying pressure on reflex points found on the hands, ears, face, and feet. So according to ancient Eastern principles, all living things are enmeshed with a life force, and depending upon where someone is from or what their foundation is, they may refer to it as chi or ki or prana. So this energy moves through the body through one of 10 vertical pathways that we refer to as zones in reflexology. When energy pathways are impeded or obstructed, the theory is that disease follows. The intention of reflexology is to remove hindrances to the energy flow. It's important that we not confuse reflexology with reflexive action or reflexes governed by the nervous system. They're not talking about reflexes in that sense. In fact, it used to be called zone therapy. And just a brief history, this primarily comes to us from Eunice Ingram. And Eunice Ingram traveled to Asia and experienced reflexology there, and she wanted to bring it back to the West, but felt that the West wouldn't be very open to the idea of energy meridians, and so developed this zone theory as a way to make it more palatable. So energy meridians in the body can be very complicated and differ slightly from one particular energy technique to another. Zone therapy, again, just generalizes it, but is still very effective. So going on, the idea when we talk about zones, if you were to take the body and greatly enlarge the foot and superimpose the foot over the body so that midline comes right to the arch along the inside of your foot, and then draw a straight line between the toes, the great toe and the second and third toe, between the third and fourth, or between the fourth and fifth. And then if you were to draw a line straight down the center of the torso, right through the nose and the sternum and the belly button, and then the next line, slightly over, so that you have 5 lines on the right and 5 zones on the right and 5 zones on the left, so that it looks like you see here depicted on the PowerPoint. In addition to that, we have transverse zones. We have one line that goes directly under the toes, one that goes under the ball of the foot, one that goes really across the heel. And so it's almost like making a grid on the foot. And if you were to superimpose that grid over the human body, then the vital organs contained within that particular spot on the grid would reflect on that spot on the foot. So this might give you a better idea. So without any words to confuse this is a color-coded map. So you see here the heart in this pinkish red, and you'll see that on the left foot shown as pinkish red. The lungs in yellow, and of course the lungs take up the whole chest cavity. Well, the ball of the foot would reflect the whole chest cavity. In the soft arch of the foot, that would reflect the soft abdomen. So the intestines, large and small, would be found there. This is a basic map from the Modern Institute of Reflexology. You'll find another map in your textbook, and if you just did a quick Google search, you'll see a whole variety of different types of maps in a lot of different styles. I chose this one because it is from the Institute of Reflexology. They have labeled things for you. Typically the toes are going to reflect anything on the head, the very tips of the toes being the brain, or the sinuses on the tips of the great toe. Obviously the neck of the toe reflects the human's neck or the client's neck. The ball of the foot is typically the lungs. On the left foot you'll find the heart. On the right foot you'll find the liver. You'll typically find that maps differ slightly from one to another, and it's important to understand that in reflexology we're talking about primarily intention. You don't have to have it dead on. You're not doing surgery to remove a kidney, you're just trying to get in the general location that would be close to the kidney. Hand strokes used in reflexology include thumb walking, which is used to explore within a zone and searching for signs of stagnant energy flow. I'll demonstrate these strokes for you in class. Point work, when you find a particular area and you have found some indication that it needs work, then you're going to use point work to stimulate a specific reaction in that region. And then we use general foot relaxation techniques. We give a general relaxing foot massage at the start and end of the session that's really just designed to relax the muscle tissue, make it easier for you to palpate and feel. When doing thumb walking, the therapist is actually looking for certain sensations that they're able to pick up with their thumb. And the three things we are looking for, not hollow, sorry for my typo. The three things we're looking for are crystals, which may feel like a grain of sand or possibly a little bit larger directly under the skin. The other thing you may feel for would be resistance. And when I say resistance, I want you to remember that there'll be different qualities on the ball and the heel of the foot than you have in the arch of the foot. Resistance is just a change as compared to the surrounding area. Okay, so it's not the difference between the arch of the foot to the ball of the foot, but the ball of the foot close to the midline versus the ball of the foot close to the pinky toe. So that's important to note. And then hollow. So if you, again, it's the same thing compared to the sensations in the area or the amount of resistance in the area. If it's firm, 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 and then all of a sudden you get one little spot that feels soft and hollow, that can sometimes indicate that an organ has been removed. Crystals or granules are typically an indication that there's a little bit of lactic or uric acid or calcium deposits built up right in that spot. The smaller the little piece of granule is, the younger it is, the more recent it is, and the larger the granule, typically the older it is. You may find a lot of other things, a lot of little crunching in the foot. Typically that's connective tissue. You can feel free to work it, but it's not usually an indication of restricted energy in the region. So what the client experiences. So the most common sensation the client experiences is sensitivity, which is typically an energy sensation, and it's a good thing. We want them to feel that. They may feel discomfort or tenderness directly under an area that's being worked. It's an indication that that area needs more work. Within reason, we don't want to create inflammation, but don't take discomfort as a negative sign. Pain can be considered a healthy sign as it indicates clearing and cleansing, cleaning of the body. However, we always want to work within the client's threshold of pain. So if the client tells you something is painful, you want to lessen pressure but continue to work the region. Don't stop. As the pain subsides, you can gradually increase pressure as you progress. And then there may be some redness, which may indicate a detoxification process, so that also would be a good thing. When the session is over, the client will typically feel profoundly relaxed. We do want to advise our client to drink plenty of water to aid in detoxification. In severe cases, the client may complain of a headache or a stomach ache, and that's usually an indication that you effected a change on that energy meridian. That's also a good thing, and the body is cleansing and processing. So it is helpful to prepare your client that may be something they experience, especially if you're working with them for the first time. I want to take a minute and talk about the anatomy of the foot. I want you to, when you think of the bottom of the foot, I want you to understand that your skin is thickest on the bottom of your foot, thicker than it is anywhere on your body. It's thinnest on your eyelids and thickest on the sole of your feet. So oftentimes it's difficult for the therapist to actually feel a granule or something beneath the skin, a toughness, a thickening, or a hollowing. However, your client may feel things before you do because there are a lot of nerve endings on the foot. So you need to keep in mind that the skin is very thick, and directly underneath the skin you've got a very thick pad of fat. It's the one place on your body that you really do want fat. Now we're working through thick skin, a pad of fat, and beneath that you're going to find connective tissue. Excuse me just a minute. I'm sorry. Okay, so the connective tissue again is very dense. We call it the plantar aponeurosis. It's a broad, flat band of connective tissue used for muscle attachments. And it's under that you begin to feel muscle and changes in qualities of the muscle. So again, it's important to note that it's very difficult for the therapist to really feel things with their fingers, and it takes sometimes years of training for someone to actually feel. I mention this because on the illustration here of just bone, you'll see under the great toe, you see the very top digit, you see the little middle part, the long stem of your toe, and then you see the long bones that are really within the solid framework of your foot. It's called a metatarsal. That first metatarsal, right at the base, right where it comes up to the little cube bone, it has a bony projection, not kind of on the inside or toward the middle of the foot. That bony projection is tender on most people. It is an attachment point for two major muscles, and it can become inflamed due to attachment point tendinitis. So if you're working on your classmate, I'll review this in class. If you're working on your classmate or if you're working on a loved one and they feel bruised and achy and you're right in the arch of the foot, right inside the arch, that is, I want you to know that it's bone and that it's not a change in the quality of the tissue. It's not an indication to stay there and work. I don't want you to be afraid of it, but I also don't want you to create a lot of inflammation and tissue damage working and working and working over top of a bone. So we'll palpate that before we start our reflexology session. Okay, general precautions. If you're working with a client that has a diagnosis of neuropathy, which is common with diabetics, what that means is that they have deadened sensations in their foot, that the nerves are not signaling properly, and the client may be unable to provide feedback regarding pressure and pain. It is a situation where you need to be very cautious and use light to moderate pressure at most. Never heavy pressure, because we can't get proper feedback and we don't want to hurt them. The other general precaution would be frailty. So if your client is frail or in a weakened condition from chronic illness, advanced age, disability, etc., then you just want to shorten your treatment time. It doesn't mean they can't have a foot massage. It just means that it needs to be shorter. Pressure should be lighter than usual, and sessions can be more frequent if they want, but they just can't be as long as you typically would work with a client. Local contraindications: you would never work on anything that's a cyst, a corn, a callus, a bunion. Obviously, if they have known bone spurs or neuropathies, no skin lesions, obviously, ever for any massage. Any open skin lesion would be a contraindication. They wouldn't get a massage. Warts, fungal infections, ingrown toenails, gout, their feet have to be in pretty good condition. Okay, so you wouldn't work if they had had a recent surgery or injury, and you definitely would not work if they've had pitted edema. I don't have a whole lot else to offer until we get to class. I'm going to very briefly go over a few other things on this when class starts, just to make sure everyone's clear on where that one bone is close to the surface, and I'll demonstrate the hand strokes for you then. Okay, see you all in class.